Hi there, it's Justin Lubino with Senior Advisors, and it's that time of year again to review your Part D plan to make sure you've got the right prescription coverage for the upcoming year. At Senior Advisors, we review all of our clients' prescription analysis to make sure they've got the right Part D plan for the upcoming year. We offer two options to get us your latest prescription information. Option one is using Medicare.gov website to pull up the drug list from the prior year and review it and make sure it's got the right drug information, dosage, frequency. And then we take that drug information and we determine the best Part D plan for the upcoming year. That option one is available to existing clients who we've done a Part D analysis for in the past. You will get an email with your drug list ID and password date, so you can use option one. For other clients who we have not done a Part D analysis for in the past, or we do not have your drug list ID on file, option two will be available to you, where you can use our online web form to enter your drug information, and we will take that information to complete your Part D analysis for the upcoming year. Option two is also available to if you're not an existing client and you'd like us to review your Part D plan for the upcoming year. Option two is also available to you. We will need the information if you choose either option one or option two by November 15th, so we can complete your Part D analysis by the December 7th deadline to get enrolled for the upcoming year. At the bottom here, we've got some information regarding that drug list ID and password date. This is really just to show you an example for those folks that will be eligible for option one, what that drug list ID will look like, and the password date as well. So you'll get that information emailed to you if we have that information on file, so that you can pull up your drug list and you don't have to re-enter in all the drug information if we have that drug list ID. So I'm going to walk you through each of these options. Again, option one is using Medicare.gov. So if you go to Medicare.gov, and we're going to just go back there just to show you on the top of Medicare.gov, you have an option that says Drug Coverage Part D. You're going to want to select that and then find Health and Drug Plans. And it should take you to a screen that says Medicare Plan Finder. Okay, we're going to enter in our zip code. And again, we're just going to go through a few steps here just to pull up our drug information so you don't have to re-enter in all the drug information from the prior year if you have the drug list ID. We're going to select Original Medicare under the first question, and then I don't get any extra help under the second question. And here's where we go, step 2 of 4, where we get to, and of course the survey pops, enter your drug information. Okay, so here is where we are going to try to retrieve our drug list from the prior year. So this is so you don't have to re-enter in all your drug information each year. We're trying to make the process a little easier on your behalf. So the drug list ID, again, if you've received an email with this information, you can enter this drug list ID here with the password date. And I'm just going to enter in the information that you saw on the prior slide for the drug list ID that was emailed on the password date of August 20th, 2016. These are the two key data points that you want to make sure you're able to enter if it's emailed to you, and then retrieve my drug list. And what this does is this pulls up the drugs that were entered previously for that drug list ID. And if these are all the right drugs that you're still currently taking with the quantity, that's basically all you need to do. And you need to just send us an email and let us know that the drug list is complete. Nothing has changed with your drug list from the prior year. But you definitely want to pull that up to make sure that it's still accurate before you tell us that nothing has changed from the prior year, because we're going to use this to determine the best Part D plan for you. If you need to add a drug, you're able to do that right up here where type the name of your drug. So if you need to add a, let's just say Lipitor, and we add in the Lipitor, add similar drug. You can select the dosage. Let's say you're taking 20 milligrams and you're taking one a day, which would be a quantity of 30 per month. And then you just click Add Drug and Dosage. It gives you the option for the generic. Let's accept the generic. And it just added in that atorvastatin. And of course, I already had that on the list for the 10 milligrams, but maybe you also got prescribed another 20 milligram dosage. So you can add that into the list. You can also remove drugs. Let's say you're no longer taking that 10 milligram. You can remove that from the list. And now, if the list is up to date, you can send us that email. Again, it's info@senior-advisors.com, and letting us know that your drug list is complete, and we'll complete the Part D analysis from there. And that's essentially option one. Again, that's if you're pulling up your drug list ID using Medicare.gov, so you don't have to re-enter in your drug information from the prior year. You can make adjustments if you need to, or if everything is good, you just let us know, and we can complete that Part D analysis for you. Option two, which is available to existing clients who do not have that drug list ID, or even prospects. If you're not currently a client, you'd like us to complete a Part D analysis for you, you can go to our website at senior-advisors.com. Under Products and Services, you select Part D Prescription and then Free RX Analysis. And this takes you to the form that's on our website, where there's some information about the free prescription analysis. There is a video here as well if you want to walk through the entire process of doing your own Part D analysis on Medicare.gov. You can do that here. But if you just want to enter in your drug information and have us do a Part D analysis, this is where you would enter in that information, your name, your phone number, all your contact information. You would also select whether you're willing to do mail order drugs or not, and your pharmacy's first choice and second choice. And then you enter in your drugs, the name of the medication, the dosage, how many times per day you're taking it. If you're willing to take a generic is what this box states. And then you can enter any comments here. If you want to enter your broker's name here, you can do that. And then you click Find the Best Part D Plan. And that basically will submit the information to us, and we'll be able to then review that to complete your Part D analysis. Again, we can't do that until October 15th, but if you submit it early, we'll store that until then, and then we'll follow up with you when we can do the analysis for the upcoming prescription drug plan and let you know which is the best plan for you. So again, those are the two options that we offer for you to get us your latest drug information. Make sure you do that before November 15th so we can get it in by the December 7th deadline. And if you have any questions, you can always give us a call at the numbers listed below, or go to our website to get any additional information. If you found this useful and helpful, you can subscribe to us on YouTube, and you can like us on Facebook to make sure you're getting all the up-to-date information. Thanks, and have a great day.